أعزائي طلاب المرحلة الرابعة السلام عليكم ورحمة الله وبركاته. Today our lecture is about drugs that are used for erectile dysfunction ED. This disorder is a common disorder in males and it is most likely related to very common risk factors such as psychological causes, vascular diseases, diabetes, certain medications, depression, etc. These are the most common causes that are non-causes for this disease. Drugs that are now used to treat erectile dysfunction can be summarized in two major categories, either alprostadil or phosphodiesterase 5 inhibitors. And here we have 4 drugs, and we will discuss this in a minute. But now it is considered that PDE5 inhibitors is the first line for ED due to their efficacy, safety, and easy of use. With phosphodiesterase 5 inhibitors, as we said earlier, we have 4 drugs: sildenafil, vardenafil, tadalafil, and avenafil. And all of them are approved for ED. All of these drugs, the 4 drugs, are equally effective for ED, and also they have a similar side effect profiles. However, they are different in duration of action and the effect of food on drugs absorption. So here it is mostly the difference between these drugs is pharmacokinetic, is not the potency or efficacy. The mechanism of action of these drugs, as we said, it is similar in all these drugs. But before starting with the mechanism of action, let's take a look on this figure. So when there is a stimulation, it causes most relaxation of smooth muscles in this area. And smooth muscle relaxation means more blood flows into the sinusides, and sinusides here are, after relaxation, become full with the blood, and this fullness with the blood causes an increase in the size. The mechanism of this effects happens through, as we said, like when there is a stimulation, this causes an increase in the production of nitric oxide, and nitric oxide increases the activity of guanylyl cyclase, and this increases cyclic GMP. Cyclic GMP is the muscle relaxant agent here and causes smooth muscle relaxation, as we said, in the corpus cavernosum, and this causes an increases in the blood flow and erection. So all these drugs are acting on phosphodiesterase, and phosphodiesterase is the enzyme that is responsible for the breakdown or destruction of the cyclic GMP. So by administration of phosphodiesterase 5 inhibitors, we are increasing or there is an elongation in the activity of cyclic GMP, and this causes muscle relaxation for longer time and causes the effect. And cyclic GMP causes muscle relaxation through reduction of intracellular calcium ion inside of the corpus cavernosum. And as we said, through phosphodiesterase, the activity or the half-life of the cyclic GMP is controlled by phosphodiesterase. In general, we have 11 isoenzymes of phosphodiesterase, And sildenafil, vardenafil, tadalafil, and avenafil, all of them are working on PDE5. And PDE5 is the most common isozyme of all phosphodiesterases in the corpus cavernosum. So they are specific in their effect. However, their specific is not like entirely specific for this isozyme 5. They could work on others as well. So this is the mechanism of action. It is a direct mechanism of action for all these drugs. Pharmacokinetics, and this is the point that we said earlier, that these drugs are different in the pharmacokinetic characteristics. So here, let's talk about this in more detail. Sildenafil and vardenafil, both these drugs are taking around 1 hour to produce their maximum effect, or it is the onset of action. However, in comparison with the others, avenafil and tadalafil, avenafil is the quickest one. It acts much faster than all the others. While tadalafil, as we see here, it takes longer time for its onset of action. On the other hand, we can see here like sildenafil and vardenafil, both of them are working for about 4 to 5 hours or 4 hours. Avenafil has a similar duration of action, unlike tadalafil. Tadalafil, it works for longer time, as we can see here, for around 18 hours, and its activity could continue for up to 36 hours. So it acts for much longer duration of action. And this is the main cause for the recommendation of using tadalafil daily. With the food interaction, we can see here both sildenafil and vardenafil are affected by food. And this is decreases the activity and bioavailability of both these drugs. While on the other hand, tadalafil and avenafil are not affected by the presence of food. And mainly here we are talking about heavy meal food. The other difference is vardenafil is also available as oral disintegrating tablet, this formulation. And this formulations, it is only affected by the water, so it is better placed under the tongue. And there is no need to administer any water with this formulation. And the bioavailability of this drug, vardenafil, with the oral disintegrating tablet is better than the film-coated tablet. And this is the causes for considering this formulation. I think these are the major differences in the pharmacokinetic characteristic of all these drugs. All of them are metabolized by cytochrome 453A4 isoenzyme. So that dosage adjustments for sildenafil, tadalafil, and vardenafil is highly recommended in patients with mild to moderate hepatic dysfunction, while all of them should be avoided in patients with severe hepatic impairment. While in the presence of the severe renal dysfunction, the doses of sildenafil, tadalafil should be reduced, and the daily dose, as we said, with tadalafil and as needed avenafil are contraindicated. Adverse effects. Mostly adverse effects due to PDE5 inhibitors are related to the vasodilation that is produced by these drugs. So patients could suffer from headache, flushing, dyspepsia, and nasal congestion, and mostly these side effects due to the vasodilation. But the other good side, all these side effects are mild, and men with ED are rarely discontinue their treatment because of these side effects. Also, patients could suffer from color vision or disturbances in color vision. And this happens due to these drugs are not entirely specific for PDE5. They are also working on PDE6. And this one is found in retina and causes the disturbances in color vision. In all these drugs, tadalafil is an exception. It means like it could cause these side effects, but with a lower incidence in comparison with the other agents. The other side effects, so here we talked about these ones here. Then we have the sudden hair loss. And sudden hair loss, this one could also produced by these drugs. And also, as we said earlier here, like mostly side effects are related to the vasodilation. This could happen due to changes in the sinus pressure because of the vasodilation, sinus pressure in the ear. Tadalafil also could cause back pain due to its activity on the PDE11, and this one is found in the skeletal muscle. So here, these are very specific side effects, let's say, for PDE5 inhibitors. In general, patients or patients with cardiac risk for cardiovascular diseases are in general with risk if they are taking these drugs, because the sexual activity, it is in general, it is inherent, it is related to cardiovascular diseases. And PDE5 inhibitors should be, so that PDE5 inhibitors should be used in caution with patients with a history of cardiovascular diseases, because this could potentiate or there is a synergistic effect on the cardiovascular diseases. PDE5 inhibitors should not be used more than once a day. And there is also a rare side effect could happen with these drugs. It is called priapism. Then we have drug interactions. Because the ability of here, let's say, the side effects with these drugs is most likely related to the hypotensive effect that could be produced by these drugs, especially as we say that these drugs are vasodilators. And here it is a short story about these drugs. And the first one has been discovered with all these drugs, it was the sildenafil. And sildenafil was designed in primarily to be used as antihypertensive drugs. But in clinical trials, this drug, sildenafil, failed in the clinical trials as antihypertensive drugs, but they noticed the other effect of these drugs for ED. So there was like repurposing or reshifting for using this drug from the ED to the from the hypertension to the ED. So this comes from the effect of these drugs. So I talked about this story just to put in your mind that mostly the drug interactions that are related with these drugs are hypotensive drug interaction. So because of the ability of PDE5 inhibitors to increase the activity of nitric oxide, administration of other drugs or medication that considers as a source of organic nitrates, such as nitroglycerin, isosorbate dinitrite, mononitrite, is contraindicated. The other drug interaction here, we have a drug interaction with the alpha-adrenergic antagonists. And it is not like patient with benign prostate hyperplasia. This drug is used for prostate hyperplasia. And at the same time, those patients could suffer from the ED, so that it is a very common practice to use PDE5 inhibitors with alpha-adrenergic antagonists. So it is highly recommended for those patients to be on a stable dose with alpha-adrenergic antagonists. And also it is recommended to start with low doses, very low doses of PDE5 inhibitors until to reach to the required effect. The doses of PDE5 inhibitors also should be reduced or monitored if we are administered other cytochrome 450 inhibitors, such as clarithromycin. Also, there is a risk for the drug interaction to cause QT prolongation in comparison with the drugs I mean, this it is a very specific, or it is a kind of specific side effect, maybe only with vardenafil and dronidaron. And here we have the second drug, and also at the same time in the second class that is now used for ED. And here we have only one drug, alprostadil, and alprostadil is synthetic prostaglandin E1. And this one allows for relaxation of a smooth muscle of the corpus cavernosum. It is a similar effect to the PDE5 inhibitors. As we said in the introduction, PDE5 inhibitors is the first line therapy for ED. However, alprostadil could be considered if the patients are not good oral candidates. So maybe they are not able to take oral medications, or maybe there is a risk of systemic side effects, as we talked about, as we talked with the PDE5 inhibitors and their side effects. So it is a kind of using a local drug to treat ED. Mechanism of action. We can say here like alprostadil works by unknown mechanisms, but it is believed that this drug increases the concentration of cyclic AMP in the corpus cavernosum, and as the result of increasing the cyclic AMP, there is an increase in the activity of protein kinase, and this one causes muscle relaxation and dilation of cavernosal arteries. Pharmacokinetics, alprostadil in general has a very